And welcome back to The Factor Uncensored. Now, in that last segment, we talked about what you can do for the homeless in our community. Now we're talking about what you can do for you. Dr. Danish Ali with Arch Point Pain Institute joins us to talk about what you should do and how you should be eating this holiday season to watch your health. Dr. Ali, you know, it's that time of year. Many of us will be in comas with all the food that we eat, the heavy food that we eat. But many of us have medical problems like high blood pressure, we're diabetic, we have a long list of problems. How should we be eating with caution or with care during the holidays, specifically coming up Thanksgiving?
I know, Isaiah, you're right. I mean, this is the time of the year that everybody gets together, families are together, we're having all the Friendsgivings, Thanksgivings. And so, yeah, I think the biggest thing is, Isaiah, portion control. Eat very carefully, right? Meaning that, if you're diabetic or you have blood pressure issues, if you're, for example, the high blood pressure we just talked about, try to consume less salt, right? We just saw a recent study that talked about how just consuming 1 teaspoon less of salt can be enough as one blood pressure medication. And so we see some of these effects, and that's how, so important to have portion control, limit your consumption on salts. And then for folks that have diabetes, Isaiah, taking less of sugary items, whether it be, snacks and desserts, some of those appetizers that are high in sugar. Those are all things that we can do to, continue to maintain some sort of a figure throughout the holiday, and also to keep those blood pressures and diabetes numbers in control.
Should you call the host in advance to find out what's on the menu, or if they can accommodate you if you're someone important to them and a family member? Should you call in advance and can you accommodate me because I have high blood pressure, I'm a diabetic, what have you? Can you help me out with some of the food that you make? Or is that doing or asking too much?
I don't think so. I think, Isaiah, that's really right on point. I think it's like, folks that have allergies to different foods, right? People know that, just like peanuts or shrimp. I think we should do the same thing for blood pressure and salt or sugary items. I think those are things that we should be discussing with family members. And maybe what they'll do is they'll make a separate plate that may not have all that salt in it. We were talking about that gumbo, the 2 different versions of gumbo that your family members make you, one of them may not have that salt intake, that high salt that others may. So, you want to be transparent. I think it's very important, and tell them, hey, I have some of these issues and some of these medical problems. And as much as I love that food, is there a possibility that maybe you could make one without less salt or less sugar? Those sort of things. That I think it's right on point.
And of course, like you just mentioned with the gumbos, also the allergies. If you're allergic to seafood or shellfish, then can you make one without the shellfish in it?
That's right, Isaiah. And those are things that, we should be discussing in advance. People should know about it, because the last thing you want to do is, you have somebody over and you put them in some sort of an allergy attack, and then you got to send that person to the hospital. That's not a good day, right? And that person probably won't be coming back to you.
Grandma is suing me now.
Right, exactly. Yeah, grandma's suing me for going to the hospital now.
And obviously, a lot of people say when we eat Thanksgiving, we get so sleepy and we get so tired and sluggish. Would you advise him to just go outside, maybe walk around a little bit, play a little sports, and keep from just going straight to sleep after eating a big meal?
Correct. Yeah. Again, going back to that portion control for sure, Isaiah. If you limit your portions, if you, maybe take a little bit of a break. I know that people like to go eat a little bit, go do some Black Friday shopping, and then come back. Portion control is good, but also, as you mentioned, yeah. I mean, if you can, after you've had a meal, take your family. Hey, let's go to the park, or let's go walk around the neighborhood or something, just to burn off a little bit of those excess calories that we may have consumed. I think that is perfectly on par.
And make sure you stay with us here on The Factor Uncensored. We'll continue this conversation right after the break. And welcome back to The Factor Uncensored. Cheat days on your diet during the holidays are normal. Most people do it. But do not have a cheat day with your medicine. Dr. Danish Ali talks about why it's more important than ever to keep up with your medications during the holiday season. And of course, if you're going out of town, you're flying out of town, a distance from your home, make sure if you're on those meds like blood pressure pills, diabetes medication, take it with you, pack it with you, right?
I say that you're right. That 100%. You could not have hit the head on the nail there. For sure, we should be doing that. Take your meds, especially pain medications. Right? Some people forget them, and then now they're in pain, or worse, they may withdraw. Same thing with some psychiatric medications. So yes, take all your meds, consume them like you normally would. Consume them at the same time that you normally do as well. Those are all very important things when you are traveling. And again, we've talked about this for many years. If you're sick, if you're under the weather, put a mask on. If you're concerned you may have COVID, get tested. The last thing you want to do is spread this virus around or get even some of your family members sick. The flu numbers are high this year, Isaiah, and again, as we've talked about, COVID numbers as well. And so just focus on that. If you're not feeling well, maybe take a break this year, or, wear that mask and just be a little bit more cautious than not.
All right. Dr. Danish Ali from Arch Point Pain Institute. Always good to see you. And of course, to everyone, enjoy your holidays. And you too, Dr. Ali. We appreciate you here on The Factor Uncensored. And of course, we'll see you in December.